want to show a technique that I use with clients to help them to kind of connect psoas to leg. And this is a technique I do sometimes when people seem to be kind of having a short stride or tight hip flexors. So in addition to working hip flexors in this area, one thing I'll do is locate psoas, and again, I'll be somewhere around this vicinity, and then I will prompt them to lift up their knee just a few centimeters off the table so that they can activate psoas and they feel the psoas under my fingers. So that's just the one step. You know, now they're already becoming aware of the psoas, where it is in their body and how it relates to their leg. Another thing I do sometimes to give the client a sense of self and where the psoas is while I'm palpating the psoas, I may internally rotate or externally rotate their leg so they feel the movement of the psoas under my fingers, and then I may ask them to do it on their own so they feel the movement coming from psoas. Since it's attached to lesser trochanter, they feel that movement of psoas internally rotating and externally rotating as they move their leg. The next step would be to, while my hand is in the psoas territory, I ask them to slowly lengthen this right leg, almost like imagining that their leg is getting pulled this way, at the same time that I'm working the direction of resistance in that psoas. So sometimes if the DR, the direction of resistance, is superior, I may be putting a slight angle of force in the superior direction while the client is slowly lengthening this right leg. This, in the Morales method, is active lengthening. So we're doing a little bit of active lengthening in addition to giving the client that awareness of psoas in their body. A couple of things to be aware of when you're asking the client to slowly lengthen this right leg is that they don't use too many muscles. What we want is really kind of specific and mindful movement. So as I'm working here, we want this leg to slowly lengthen. We don't want glutes to overactivate. We also don't want the other leg to activate. Sometimes people will go into this kind of gross motor motion pattern where they use too much of their body. And at first that's okay, but eventually what we want is a little bit more of a fine motor movement. And again, I'll be here as I ask them to slowly lengthen this leg. If they start to lift the leg as well, we don't want that, and so we just repeat, do it over again and say, try to slowly slide the leg without having to lift it, and try to use as little musculature as possible. A great tip to help the client is to imagine that their heel is sliding out and not have your client plantar flex so that they're pointing with the toes. Instead, they are essentially pointing with their heel as they slowly slide their leg in the inferior direction, all the while your other hand is on the psoas. Hey folks, thanks for watching the Morales Method YouTube channel. If you want more information on relieving low back pain, please click on the link above for our online course. And if you want more recommended videos, then please click on the links below. And finally, please don't forget to subscribe. Thanks.